Hi, I'm Jessica Bosquez. I'm a physical therapist with Back in Action Rehabilitation in our Mayville clinic. And as our country tries to return to some sense of normalcy, we realize a lot of you have been waiting on some total joint replacement surgeries. As those are being rescheduled, we wanted to share some information with you to help you better prepare for it and hopefully have a better outcome following surgery. So we have put together a little sheet with some general information on it, some things that you maybe wouldn't normally consider. Your first thought is pain, your first thought is getting my range of motion back, getting my function back, but there's a couple other little things that are very important also. One of the first is nutrition. Sometimes after surgery, especially because of the anesthetics, you don't feel real well that first week or two, you don't have an appetite, but it's so important to keep good nutrition because it's gonna be what helps you heal a lot better, that and sleep. In the event that you are sick and you don't feel great following surgery, keep some protein shake type things on hand. Keep a meal supplement drink, something like Ensure. And also make sure you take your pain medication. We have seen many people try to get off their pain meds too early because they're afraid they're gonna get addicted or they're afraid it's doing something else to their body. It's not. That first 2 weeks after a surgery, make sure you take your meds as they are prescribed to you. That is why they're given to you. It might even be more than that, but my number one recommendation, those first 2 weeks for sure, take it as you are instructed. Little touchy subject, constipation. Your medications, those pain meds, can bind a person up. You are already dealing with post-surgical pain and discomfort. You don't want to have an upset stomach and discomfort on top of that. So keep something on hand like a fiber supplement, drink lots of water, try to keep moving as best you can to help keep your digestive system moving. You're going to be a lot more comfortable. Kneeling, a lot of people know, especially after a total knee, when can I kneel again? Can I ever kneel again? Often our patients do kneel after surgery, but they might need a pillow or a foam pad to kneel on. If that's something you're ever really questioning, have a conversation with your doctor about it. Traveling, people ask, hey, can I go on vacation? Can I do this so many months after? At the very moment in time, it's probably not as much of a concern, but God willing, we get back to it. Again, have a conversation with your doctor, but one thing to keep in mind, especially if you're going to be on a long car ride shortly after surgery, your knee is going to get sore and stiff. If there's a way to keep the knee moving in the car, slide your foot back and forth on the ground, that would be fabulous. Otherwise, make a point to plan some stops throughout your travels to get out and just walk around a little bit. There are some pretty typical questions that we hear after surgeries. One that we wrote down, can I hurt my knee after a knee replacement with too much activity? That thing is in there nice and solid. Your physician has done an amazing job at measuring and making sure you have the right components. Something major fall, major twist and down you go is really the only way you're gonna hurt anything. You might have some physical muscle soreness, joint discomfort, if you will. Beyond that, you're not gonna wreck that thing. Can I go in a hot tub or take a bath? Discuss it with your doctor. Biggest thing is that incision has to be healed. You don't want any chance of infection. How long will the stiffness and swelling be present, especially in the case of a knee replacement? Honestly, that swelling and stiffness is usually the last thing to go. So do not be surprised if that knee is always a little larger than the other and if the swelling takes almost a year to go away. When can I drive? Ask your doctor. In general, depending on which knee you have done, of course, if it's the right knee or right leg, it might take a little longer to return to driving just because you need to use that more to drive. But have a discussion with your doctor. And lastly, how long should I follow my hip precautions after a hip replacement? Again, that's a conversation with your doctor. Some say 6 months, some say a year, some have other strategies that they like to utilize, other protocols, so have a discussion with your doctor. And if you have other questions for us, please feel free to contact us at any time. If this went way too fast for you, do not worry. If you go to backinactionrehab.com, you can go right to our webpage, and then right up here on the top right corner, click on that little drop down, go to the resources section and we will have this sheet right here online for you to print off and reference again. Stay safe, stay healthy.